Hello. Now we're going to talk about Everolimus-eluting bioresorbable scaffold for coronary artery disease. My name is Jorge Briones. I'm from Universidad Católica Guayaquil. I'm on Facebook, Jorge Briones, and on Twitter, Jorge Briones 08. So, introduction. Patients with coronary artery disease who receive metallic rock-eluting coronary stents observe events such as late target lesion failure may be related in part to the persistent presence of the metallic stent frame in the coronary vessel wall. Here I have the first video.
Abbott's bioresorbable vascular scaffold, brand named Absorb, has the potential to effectively treat heart disease while restoring natural vessel function in a way not possible with permanent implants. Heart disease causes blood vessels to narrow or become clogged, limiting blood flow. The Absorb bioresorbable vascular scaffold is designed to open clogged blood vessels and provide temporary support to restore and maintain blood flow to the heart. Once Absorb is in place, a drug called Everolimus is released over time. Everolimus reduces inflammation and tissue growth to help prevent re-narrowing of the vessel. As the vessel begins its restorative process, Absorb slowly metabolizes to water and carbon dioxide, both elements that occur naturally in the body. Eventually, Absorb completely dissolves and the vessel can remain open without the extra support of the scaffold. Since a permanent implant is not left behind, a vessel treated with the Absorb bioresorbable vascular scaffold may eventually move, flex, and pulsate, similar to a natural vessel. The potential to restore the naturally occurring vessel functions, or vascular restoration, makes Abbott's Absorb unique as a treatment for heart disease.
Clinical outcomes. There was no significant between-group difference in the use of dual antiplatelet therapy during hospitalization or 30 days. At 1 year, the use of clopidogrel was less common and the use of prasugrel was more common in the Absorb group than the science group.
The development of newer cardiac stents has reignited the debate. Should patients with multivessel coronary artery disease undergo PCI or CABG? To answer this question, the BEST trial compared PCI using second-generation Everolimus-eluting stents with CABG in 880 patients from 27 sites in Asia. Eligible patients had angiographically confirmed multivessel CAD and were considered to be suitable candidates for either PCI or CABG. Patients with clinically significant left main disease were excluded. At a median follow-up of 4.6 years, there was a significant between-group difference in the primary endpoint of death, MI, or target vessel revascularization, which occurred in 15.3% of the PCI group versus 10.6% of the CABG group. There was no significant difference in death or stroke between groups, but spontaneous MIs and repeat revascularization were significantly more likely to occur with PCI. The full trial results are available at nejm.org.
The results. Target lesion failure at 1 year occurred in 7.8% of patients in the Absorb group and in 6.1% of patients in the science group. There was no significant difference between the Absorb group and the science group in rates of cardiac death.
Abbott's bioresorbable vascular scaffold, brand named Absorb, has the potential to effectively treat heart disease while restoring natural vessel function in a way not possible with permanent implants. Heart disease causes blood vessels to narrow or become clogged, limiting blood flow. The Absorb bioresorbable vascular scaffold is designed to open clogged blood vessels and provide temporary support to restore and maintain blood flow to the heart. Once Absorb is in place, a drug called Everolimus is released over time. Everolimus reduces inflammation and tissue growth to help prevent re-narrowing of the vessel. As the vessel begins its restorative process, Absorb slowly metabolizes to water and carbon dioxide, both elements that occur naturally in the body. Eventually, Absorb completely dissolves and the vessel can remain open without the extra support of the scaffold. Since a permanent implant is not left behind, a vessel treated with the Absorb bioresorbable vascular scaffold may eventually move, flex, and pulsate, similar to a natural vessel. The potential to restore the naturally occurring vessel functions, or vascular restoration, makes Abbott's Absorb unique as a treatment for heart disease.
Conclusions. Treatment of non-complex obstructive coronary artery disease with an Everolimus-eluting bioresorbable vascular scaffold as compared with an Everolimus-eluting cobalt cranium stent was within the per-specified margin for respect to target lesion failure at 1 year.
"65-year-old Brenda Bryant has a strong family history of heart disease. Her mother died of a massive heart attack at 67.
I have to admit, I worried. Hang on.
Brenda is a long-time bus driver for special needs kids.
I've always loved my job. Doing it for 35, 36 years, I guess I should love it. I'll see you tomorrow.
The job requires a lot of lifting as well as driving. Nothing Brenda couldn't handle, but then she began noticing a change.
I would come home and I would just collapse in my chair. I was getting real tired. Let's go for walkies.
Her daily walk with the family dog suddenly became difficult.
Now you get the pain down the arm. When I first started to walk, that was a symptom.
A symptom of heart disease, the #1 killer in the U.S.
I was lucky.
For Bryant, an angiogram revealed a dangerous blockage requiring a stent.
Stents were revolutionary in their introduction in the early 90s, making the angioplasty procedure very reproducible and almost eliminating the need for emergency bypass surgery.
Traditional stents are made from a metal mesh which keeps the artery open. The next generation of technology? Stents which dissolve over time. No metal means a lower risk of re-narrowing. It reduces the need for aspirin and superaspirin, and should you get blockage elsewhere, fewer complications.
There's a lot of promise and excitement about this technology, but it requires very rigorous study.
At Dartmouth-Hitchcock, clinical trials are underway on the Abbott bioresorbable stent. A randomized blind study is being used, which means patients won't know which type of stent they get. Enrolling in the clinical trial was an easy decision for Bryant, who found the idea of a dissolvable stent appealing.
I was thinking, that sounds pretty good, that I wouldn't have that foreign substance in my vein forever.
After being outfitted with a stent, Bryant was sent home the next day, able to resume regular activity.
What a difference. Gosh. After they put that in, it was like immediate relief. I wouldn't have been able to gone out and thrown that ball. I would have been out of breath and I couldn't have done it.
Dissolvable stents are not yet approved for sale in the U.S., but data from Europe shows them performing well.
The real challenge now is that we have such good technologies, making sure that the enthusiasm is matched by the data.
Are dissolvable stents a game changer? Maybe. While the verdict is still out, for heart patients like Brenda Bryant, it means
I got my life back. Right, Rutherford? Likes his walkies, don't ya? Were you singing, Rudy? Huh?